This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
It's a standalone hospital that's been accepting residents since 2016. And one of the nice things about it being a standalone is that it's all rehab here. The physiatrists are the primary team taking care of these units, whether it's cardiopulm, ortho amputee, spinal cord, TBI, stroke. We're able to really take ownership of all our patients and really be the primary driving factors. But that's not also to say we don't have sort of backup from other specialties, neuropsych, internal medicine, cardiology, as well as other things that the patients enjoy from certain therapies like the canine therapy and music therapy that we have here too for patients. Next slide, Ricky. Burke has gotten a lot of national attention, especially recently. We've gotten a lot of grants from things like the Reeves Foundation for Christopher and Dana Reeves, the NIH, as well as Thomas and Ames Carville, just sort of donating for all the wonderful work we do here, as well as the research institution that exists here too, really just trying to be a driving force in physiatry and all the many different fields that encompass physiatry to provide the best care that we can for our patients. We're located here in White Plains, New York. One of the great things about White Plains is it's 20 minutes from just about everything, and as well as has a great downtown area in itself. We're the 11th largest city in New York. Malls, food, all the different restaurants. I've been able to go out to somewhere to eat just about every day. Also, it's really convenient to get into the city. It's just a short train ride into Manhattan, Grand Central. I really be able to explore New York City for the first time. It's really been an incredible experience. But there's also a lot of great things locally here too. Like I said, from the downtown to sort of more rural areas for hiking, biking, trailing. I've had a lot of fun going out with seniors already and experiencing a lot of sort of the more natural areas around here too, which has been great. We're led by a lot of wonderful faculty. Right now, our program is being led by our interim program director, who's our chief medical officer, Dr. O'Park, who's really just a force here at Burke. She really wants the best for all the residents. She really wants us to succeed. She's done a lot of innovating even just this year in terms of trying to bolster our knowledge from things like anatomy, ultrasound, taking time to invite guests here to talk with us, guest lecturers over Zoom, to really just sort of give us a full encompassing knowledge of all the different areas of PM&R as it's such a vast and diverse field. We also are led by a bunch of great folks on the floors who I haven't had the pleasure of meeting all our attendings yet. But the ones I have just been really unbelievably supportive in helping us to really take charge of all our patients. It really make me feel like I'm the doctor and the one leading everything on the floors. So just a brief overview of where we're at right now in terms of scope. So we're an advanced program, which means the preliminary year is not included. We have 6 residents per class, total of 18, which is really a nice size because it feels really personal. You get to really know everybody, but it's not so small that you really feel sort of isolated and you feel sort of like you're the only person there at times. As well as the residents, we also have fellows too, which has really been a great experience to learn from them. We have 2 sports fellows and a TBI fellow who also help out with us on the floors, specifically on the TBI unit. The TBI fellow is one of the leaders on the floors and a really strong resource for us in terms of teaching and knowledge. And I'll let Preet Veer jump in here to talk about some opportunities.
Hi, I'm Preet Veer. So there are quite a lot of opportunities outside of the hospital as well. I know on the floors we currently have 3 medical students with us. So there's opportunities to kind of see what Burke is before you arrive here. There's also some committees we can be part of through AAP as well. We also participate in like medical student fairs. We also just elected the recent GMEC and PMEC, what's it called, representatives, and I think Ricky was just elected for the Program Executive Committee representative. We also take part in a lot of QI projects as well, and I know Dr. O'Park really helped spearhead a lot of those, and we can talk about some of those changes that actually happen on the floors and see the difference there. Since I'm interested in sports, I've actually been able to do a couple of like MMA sports coverage in Yonkers, also some in the city as well. So that's been a really neat experience to sort of mix in with everything else that's going on at the hospital. We also have some upcoming adaptive sports events. Quite a few of those actually take place in White Plains, so fairly local. And then there's some that are further away, which could make for a nice, day trip during the weekend. And then some teaching that Ricky himself also has been spearheading. We've been doing a lot of like optional ultrasound workshops right before didactics. That's been a really neat experience to sort of do a deep dive and do hands-on experiences right before we start didactics on Wednesdays. So moving along into didactics, they take place every Wednesday, 8 to noon. Our attendings are aware, which is really nice. So that means the floors are covered. And when we come back from didactics, we'll go to lunch and then we'll go back to the floors, sort of check in with our attendings, get sort of report about what's been going on and take over patient care, but we're not responsible for writing the notes for that days. And as noted here, we do have like a Smash Bros set up in our resident lounge. So if there's free time in between, that's definitely will be where we will be headed. We also have monthly grand rounds and lectures from therapists, attendings, fellows who are all pitching in. So you're getting quite a few perspectives. There's also oral boards prep that happens, the ultrasound workshops, as I've mentioned. We've also been incorporating weekly anatomy quizzes, which has actually been really good for me. I think it's really helped keep pace with the learning there. And then we're also going to be starting our cadaver anatomy labs in spring, I believe. And these are some of the pictures. On the right there, you see Hamir, the TBI fellow. We had a representative, I forget from what company, but we were getting to try like VR injections. So you could practice the anatomy, but you could also practice the injection techniques themselves. And then right above that is one side of our resident lounge. And it looks like they're playing Smash Bros there.
I'll talk about the rotation site. So, mainly we rotate, I'll do all our outpatient or inpatient and some of our outpatient rotations at the main campus. We do a lot of our pain and ortho sports rotations at White Plains Hospital. It's only like maybe 5 minutes away from main campus. Some of our other sports rotations with ONS Sports. So there's a lot of orthopedic surgeons, neurosurgeons, PM&R pain providers that we can work with. We do a lot of our outpatient rotations too with our sister program at Montefiore. So we'll do our outpatient, do our P&O clinic at Montefiore, and then we do our consults mainly at Jacobi Medical Center. And lastly, we do our pediatric rotation at Seton Children's. This campus is also like within 5 minutes of the main campus. So talking about rotation schedule and call. So one thing with Burke that's kind of unique is we have NPs that help cover the floors, especially, after the main shifts from like 5 to overnight. There's going to be, typically there's an NP to help, take on that load. So our in-house calls are 24, but I put an asterisk there because we hand off the call phones at 10 and then pretty much we stay over for any quote unquote emergencies. I'm a PGY 3 and I've yet to be woken up for anything after 10. And then we have a nice call room. This picture Matt took, we have a queen size bed, a TV, small refrigerator, a pretty big bathroom here, computer, little lounge chair, the Keurig. I don't know if anyone uses this. I've never seen anyone use this. So probably don't use it, but it's there. And then just the overall structure, the general structure of our program, as you move up in residency, you do less inpatient months and then you do transition to more outpatient months, which I prefer. A lot of programs, we'll kind of talk to you about how their inpatient or outpatient split is. I think ours is pretty pretty manageable. Sometimes on the PGY2 year, it might get draining, but definitely gets better as you progress. Regarding calls, as a PGY2, you do 2 to 3 weekends per month. And then as a PGY3, you do about 2 weekday calls. And then as a 4, they'll do like maybe 0 to 1. And really, the ones are when the PGY3s are away on audition rotations. Regarding benefits, I think Burke has a pretty competitive salary. PGY2, 74.5 or 74,450, 3 77, PGY4 is around 80. Put an asterisk because there's in talks that we're gonna probably raise our salaries. Hopefully sooner than later. We'll see. As many residency programs, they offer health and dental insurance. Our program provides memberships to AAP and AAPM&R. We get subscriptions to AAPM&R Q Bank, PM&R Recap, like Zach was mentioning, and other things that if we ask the program, they're very open to providing these educational materials for us. Since Burke is part of the Montefiore Health Systems, we actually get free tickets to the Yankees and NYCFC, the soccer team games as well. We get 4 weeks of vacation annually. We also get free meals on and off campus. So whenever you're on outpatient, you can pretty much spend $20 a day, and then they'll reimburse you for everything. For conferences, you get $1,500 annually, and then a $500 annual education stipend. On pretty much your first week on orientation, they'll give you pretty much every book you'll need for PM&R training. If not, you can always mention it to a program director, program coordinator, and they'll probably be okay with providing us like educational materials if we need it. And the last one, I'm sure Matt and Prefear can kind of comment on, is on-site housing. It's very convenient for those who don't want to stay near campus, save money, and be close to campus. This is our picture of wellness. So, wellness is obviously important to our program. We elect 1 wellness officer per year. They'll kind of coordinate and organize events throughout the year for us to, have dinners. Last year, we went to this like fancy spa that the program paid for. This was for Vince's birthday down in the city. This is a picture I took while I was at the Yankees game and dinners. And I think this one was an end of year dinner that the program paid for. And then this was the new PGY2 orientation bowling event. A lot of people are curious about how the program, is a young program, but where everyone's gone. So this is kind of a snapshot of where everyone's been to. I think, Burke is a young program, but this is one of the reasons why, I ranked it very highly in my list, just because they had a very strong track record of fellowships, whether it be cancer, TBI, private practice, SEI, pain, we got kind of people all over the board, which is good. And it just kind of, made it relatively quick. This is our contact page. If you guys have any additional questions, feel free to reach out to any of us. If you have, questions about rotations and setting it up, we unfortunately aren't on VSLO yet, but Maddie is working on it. But for the time being, you would have to email her, PM&R rotations at Burke. And then she's great. So she will get back to you probably as soon as you email her. And then lastly, definitely follow our Instagram page. We try to keep it pretty active on there, just so people can see how we, our day to day, what we do, and kind of see what we're about. And this is just a picture from our Christmas party that we had on campus. And I'll kind of open up the floor to any questions for you guys.
Hey, Ricky. Hey, everybody. Thanks so much for doing this. I just wanted to ask you quickly kind of how your didactics build on each other. Like, is it progressive, starting from the ground floor of the topic and kind of building on top of itself, or maybe a different way it's structured?
So this year, one of our chiefs, Michael Ding, he's been really revamping the didactics curriculum, because last year it was kind of like random topics here and there, and it would connect but not really. This year he's really trying to focus on structuring it and build on top of each other. So for example, we had like dysphagia lectures from the speech and speech therapist, and then we'll have like a aphasia and stroke lecture. So they'll all kind of build on top of each other throughout the month. And then regarding the ultrasound workshop that I kind of, I'm starting to do for everyone, I'm trying to focus on, specific joints per month. So this month has been knees, anterior, lateral, medial, and then posterior knee next week. Unfortunately, I have BLS, so I won't be there this Wednesday.
Awesome. Thank you.
Yeah, of course. There was a question in the chat. Didactics virtually. That's I can touch base with Michael Ding, our academic chief, and then potentially we can make that happen as well. So I'll keep that as a personal note to let him know. We have this question about on-campus housing. If Matt or Preeper want to take that one.
Absolutely. So they actually have an apartment building on campus. It's sort of at the back of the campus. So you're not in like a patient area or anything, but it's literally a 3-minute walk for us to sign out. It's really great. And it's probably about 60% of the cost of everything else around here. I live in a great 2-bedroom apartment with my wife. It's comfortable, it's spacious, and it just really can't get more convenient than a 2-minute walk to work.
We live on the same floor, and I have to say we have like high ceilings, and like Matt said, it's just a parking lot that you're crossing, the employee parking lot, and then you're on campus. So it's more apartments than it is dorm style, I would say.
Yeah, I guess for me, it's kind of on this same topic of living. So there's a couple of us who live off campus, whether it be in White Plains. So I actually live in Upper West Side in Manhattan. My commute's about like 30 minutes in the morning, 40 to 50 minutes in the afternoon. So I grew up in Georgia, so I was used to commuting, so it was not a big deal for me. One of my co-residents, he lives near JFK Airport, which is very far, but seems to be doing just fine.
The other thing I should mention, there's a PGY4 who lives in White Plains downtown, which is like, say, 5-6 minute drive. And you can also get subsidized housing due to just like I think the income level compared to the area. And so that's always another option. So plenty of housing options around here.
Ricky, maybe you could talk about this. Apart from MMA, what other sports do we cover here?
Yeah, so with the sports fellows, you could potentially have the opportunity to cover some NYCFC games. So the soccer teams for New York, they tend to be a little more strict because it's like a professional team. But if you work with the Monty Sports Fellows and the Burke Sports Fellows, I'm sure you can potentially get in there. So we cover a lot of like the high school and like smaller colleges in the area. So I've covered several football games. You can cover soccer games, track meets. Yeah, I think that's kind of it. So I'm not really a sport. I am sports inspired, but don't do a ton of sports coverage. But you can definitely get your hands on with like MMA, boxing, high school sports. This is kind of it for that. Let's see, how's your program currently? So we have in my class, Kenya, who's our wellness officer, she we went to med school in Ecuador, so that's one of the IMGs in our program. Board cutoff scores, that's probably would be a question for Maddie. I think that's it. Again, 2 minutes till we're done, but if you guys have any other questions or things you want to ask, privately, feel free to reach out with final questions. Zach, you rotate with us, right?
Yeah, I did an audition at Burke. It was awesome. And I grew up 15 minutes north of the hospital in Westchester. So I'm familiar with the area. It's a great area. Definitely better than living in New York City, in my opinion. But
it's nice. The campus can't complain. It's like a country club.
Yeah, no, it was fun. And after the days when I was rotating, I'd hang out with the residents at the apartment building you guys were talking about, and it's really nice. It's a good setup. All right. If there isn't anything else, thank you guys so much. Really, really appreciate you all being here. And feel free to throw in your contact info is already up. You can feel free to stay on if other people still have questions. But yeah, thank you guys.
All right, thanks, guys.
Have a great night.